Hi, this is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. Today I'm very excited to present an interview with a patient that we've been working with for the past 3 to 4 weeks. The patient came to see us with a 9-year history of rheumatoid arthritis, a chronic and debilitating autoimmune disease that affects the joints and soft tissue structures of the body. Now, despite being under 9 years of continuous medical treatments with drugs such as steroids and injections of methotrexate, the patient's symptoms continued to worsen and her quality of life became so poor that she had difficulty even walking and getting dressed without help from her husband. Now, as with all of our patients, we performed a comprehensive case history, physical exam, and functional laboratory work in order to better identify the unique causes of this particular patient's health problems. And once we collected that data, we designed a specific individualized program for her to follow that created the best conditions under which her body could get well on its own. After just 3.5 weeks, the patient is now drug-free and reports a 95% improvement in her joint pain and swelling, a 95% improvement in her ability to walk and function on a daily basis, and a 95% improvement in her overall level of well-being and happiness. The following interview is a detailed account of the patient's experience with us at the clinic and the significant improvements that she has seen while under our care.
Hi, this is Dr. Paul Goldberg at the Goldberg Clinic, and today I'm here having the pleasure to be with Mr. and Mrs. Knopfler. And Mr. and Mrs. Knopfler, you are originally from France, correct?
Yes.
Spent some time in Hong Kong?
Yes, we did.
Yes, and been in the United States for how many years now?
13.
13 years, and now they live in Atlanta, Georgia, have a restaurant there. The restaurant's name is?
Le Triskel Creperie.
An excellent restaurant, I have heard, and you should frequent it. And Mrs. Knopfler came to see us a little less than a month ago on June 11th, 2012, and today is August the 6th, 2012. And Rosemary, when you came to see us, what was your medical diagnosis?
I was diagnosed with rheumatoid arthritis.
You were diagnosed with rheumatoid arthritis, and that was by a rheumatologist that had given you that diagnosis, yes?
Yes, in France.
In France. And what was the rheumatologist having you do for the rheumatoid arthritis?
I was having injection every week of methotrexate.
Methotrexate.
Yes, and I was taking pills of Doliprane, which is Doliprane against the pain.
For painkillers, yes.
Which was my breakfast, coffee and Doliprane.
Coffee and drugs. Excellent.
Every morning.
Yeah.
Well, it was helping me to...
Just to get through the day.
Yeah, go to the restaurant and start.
And what was there any other drugs you had taken for the rheumatoid arthritis problems?
Yes, some pill you take 2 days after the methotrexate.
Okay. Had you been on steroids at all? I don't recall.
I have been 2.5 years on steroid, and then when they discovered I had osteoporose, I was given a tablet every week, which I stopped completely since I discovered the side effect of this wonderful pill.
And Mr. Knopfler, what was her general frame of mind, and how was she feeling about this, and what was her physical condition, in your opinion?
Her physical condition was really, I mean, I could see it getting worse through the month, and I knew that these drugs she was taking were not doing any good. I mean, they were doing good for a time of 1 week after the injection. Then she was suffering, and she was moaning all the time. At each move she was doing, I could hear that.
It was painful. She was in a lot of pain.
She was in a lot of pain, and it happened that after a day's work at the restaurant, when we got home, she asked me to go and get the office chair to wheel her into the house and to the table and then to her bed. She couldn't walk.
She couldn't walk.
She couldn't walk, and she was in a lot of pain. A lot of pain. And
how long had this been continuing? How long a period of time?
It has the pain has been for 9 years, but it has been going worse in the past.
All right, so it started about 9 years ago, and then gradually it's been getting worse, particularly over the past 2 years. Okay. You came and saw us a little less than 30 days ago. We got started, and let's just jump to the end first. What is your condition today?
Well, first of all, I started to sing again.
And you were an entertainer. You were in, I would call, you were in the, what was in there? We call it the Follies, I think, over here in the
Yeah,
States.
we were. I have a twin sister who has the same disease, of course, and we were singing and dancing in Broadway shows.
All over the world.
All over the world.
Right.
We perform in 25 countries. We used to sing in 12 different languages, and we had a beautiful life, but with a lot of discipline, because when you work for a big firm, you need that.
And having been so active, and actually in a very glamorous profession, in addition, makes it extra hard when you find yourself becoming disabled.
It was absolutely difficult for me to accept. I couldn't use my legs, my feet, I couldn't dance anymore. It was really tough, and I was very depressed. Very.
I can understand that. Yeah. And when you came in, we did a physical exam, we did a case history, we did some functional laboratory studies, which are different than the standard medical tests. And then we started you on a program less than 30 days ago. And what is your condition today?
I gain a lot of energy, and I would say vitality.
Vitality, yes.
Vitality,
And
energy,
mobility too.
and mobility, and I feel so happy. When I am not in pain, my joy is coming back instantly.
Yeah. Well, you know that happens when people are no longer in pain. Their mood changes, they start feeling more optimistic, and life starts having some joyful meaning to it again.
Which is nice for the husband too.
And it's nice for the husband too, absolutely. Now, did I have you take any magic pills? Did I give you any drugs? And by the way, are you taking any drugs now?
I stopped
You've
since I came here.
been drug-free.
I stopped the injection. I even, one night I was in pain and then it disappeared in the morning. I didn't take any tablet, nothing.
Okay.
We were a bit afraid when she stopped all this strong medicine, because we thought maybe she's going to suffer a lot. But she believed so much in what she was doing that it helped her to
I had
get
no
over it.
She had the discipline. She had the discipline, right. So today, your pain is how much improved, percentage-wise? How much improvement have you had?
I would say 95%.
95% in less than 30 days. And just for the record, we have not given Ms. Knopfler any drugs. There's no magic pill. She's on a couple supplements, but they're not the main reason she's well. The main reason she's well is because we did a good case history, a good physical examination, some appropriate functional studies, and we have allowed her body to be put into the right circumstances where it's now been able to correct the problems and get well on its own. No magic. And we did not treat the rheumatoid arthritis just like we don't treat any condition. And I think it's very important that everybody, including our patients, understands that. We do not believe in treating diseases. We believe in creating the right conditions for the body to get well. Mr. Knopfler, you're happy?
I'm happy, and I must say bravo to her too, because she's been very disciplined.
And that's the other big factor in a patient's recovery, is having the patient, our client, our partner, follow directions and understand directions, because Mrs. Knopfler has asked good questions, so she understands what's been going on. Because without the compliance with the client, with the patient, there's nothing you can get done. Yes, please.
I want to add something. My part, you helped me so much, so my part is, I think I just made up my mind. I will do my best to heal in order to help you the most I can. I just made up my mind, I am healing.
You had what I call the will to get well. The will to get well.
Yes.
Thank you, Mr. Knopfler, and thank you, Rosemary.
Thank you, Doctor.